came to CDC really enjoying that excitement of never knowing when you might be on an airplane before the end of the day as part of an outbreak response. I think we could probably all use a little less excitement right now, but that is something that continues to really draw me and keep me in public health. When we talk about excitement, it also, I think, highlights, looking forward, what are the opportunities? I think we have a great opportunity now as we look at the lessons learned from the COVID pandemic to improve our generic response capability, that we can move away from reinventing the wheel, but have more pathogen agnostic systems and methods to approach outbreaks of infectious diseases, as well as how we respond to non-infectious diseases and natural disasters. I think the pandemic has also highlighted the long-standing challenges we've had with inequity in health, and we have an opportunity now to really focus on achieving health equity. Well, I think every day leadership involves listening to those around us. In public health, I want to stress the public aspect, and we're here to serve the public. We need to listen to the public. As a state health official, that was clearly written into my job description. And an example I would use is the response to the opioid crisis a few years back. We were just starting to get some of the overdose data and seeing that we had really skyrocketing death rates. At the same time, I was getting pinged by some people in the community, oftentimes family members who had lost a loved one to overdose, who wanted to know what are we doing? How do we address this? I talked with behavioral health colleagues, and I realized that this is actually a public health problem. And in behavioral health, the focus is generally on client services, not on a population-based approach. So it was great to get out into the community. I've sort of evolved from a boots-on-the-ground epidemiologist to a boots-on-the-ground health policy walk, and listening to people and seeing things myself in the community. So talking to people who are in recovery, going into a variety of places, sometimes even homeless camps, to be able to hear stories from people who are actively struggling with addiction, and talking to those family members who had lost a loved one to overdose or were struggling to find treatment. Out of that, we were able to build a policy approach that I think was really public health oriented, starting with the most acute problem, and that was preventing overdoses and getting naloxone into the hands of persons who would be most likely able to save a life by administering naloxone. Also, trying to remove the barriers to treatment for addiction, particularly opioid addiction. And then finally going upstream, as we do in public health, and trying to address some of the drivers of addiction, such as adverse childhood experiences. These are all concepts that reading helped, but ultimately weren't learned from a textbook. They were learned by listening to people in the community and hearing their stories. Yeah, I think the most important first step is science education. And I bring that up with an eye towards the public health workforce of 2030, 2040, and making sure that we have a diverse cohort of professionals who are well-trained to step into those new roles, technical roles in public health, as well as the emerging leader roles. I think as we look at public health, having more of a systems approach, and looking at what worked in the past and being willing to move past that if new tools are needed. An example that I sometimes use is throughout the 20th century, the concept of interrupting the chain of causation in infectious diseases was very effective for many infectious diseases. But as we look at the broader array of health challenges, chronic diseases, injury, some of the mental health issues, and also some of the infectious disease challenges that continue to vex us. It's not as simple as just a circle that we can break with isolation and quarantine or vaccines or masks. It's a web of causation that's oftentimes driven by social factors and things that are a little bit outside of the traditional public health wheelhouse. So I think as we look at what are the opportunities over the next 10 to 20 years and where public health can improve, it is to recognize that health is really a universal factor that comes into the discussion of much of what we do, whether it's the economy or national security. And finally, I think one of the things that we'll embrace, I really hope we'll embrace going forward, is the concept of public health as a global issue. I think COVID, mpox, all of these infectious diseases are certainly great examples of how we need to work together with a global approach to public health, not just what's within our own jurisdictions. There's the old saying that microbes don't need passports to cross borders. Neither do the people might, but some of the birds and insect vectors that carry those microbes certainly don't. So we need to have a global approach to public health as we look at what's going to happen in the next couple of decades.